Okay, folks, thanks to everyone who's joining us for our next high tea. We've got Dr. Mark Wotherspoon here, who, by popular demand, Mark, is presenting a segment on aged care. Now, we're going to be doing it a little bit differently because I'm going to be in control of the slideshow, and Mark is going to be in control of the dialogue. So you'll just have to indicate to me. And Mark, I get a 10-minute warning when we're running out of time, so that'll give us an indication. Okay?
Great.
All righty. Okay, so I'm just going to flip over to your screen now. Okay, and over to you.
Okay, wonderful. So if you've got the silver fluoride Q&A slide up.
Yes, that's the one.
Slide number 1. Okay, wonderful. Well, firstly, thanks very much, Kathy, for reaching out and contacting me. And I've got to say that it was a year and a half ago that I attended one of your presentations on silver fluoride, and that sort of reignited my passion for the material, for the technique, and I've been very grateful for that seminar that you provided, because it not only rekindled my interest in silver fluoride, but it gave me a lot more structure. And I think one of the benefits of the ARMOR approach is that it does offer the structure that's so critically important, actually, certainly for the work I do. So aged care is my thing. I am working as a general dentist for Defence as well, and as I might have mentioned before, many years in private practice before that. But silver fluoride for me recently has been an extremely important and useful tool when I'm out and about in aged care facilities, and also for people who are housebound for any reason, and also certainly for my special friends in the special needs community who I get to work with as well, and often in their own group homes or private residences. 4 years ago, I set up Dentist to Your Door, which is it's our little logo there. And if we could just flick to the next slide, please, Kathy. I'll try and flick to my next slide. Okay, so that's my business card, and as you can see, you know, I work out of Best Street Dental, so I'm not working out of my carport or my garage, and I do find that it's a lot easier, and I think it's very important to be working these mobile or portable services out of a fixed clinic, because it allows me to have you know, all my sterilisation and all my financials, record keeping is all done to one standard, and that's when I am talking about portable dentistry, and you'll see this in a moment, I suppose, and how it's related to silver fluoride, is that there is only one standard, whether you're working remotely out of your surgery or whether you're working in your fixed clinic. Just the next slide, please. There we go. So just to give you a little idea as to what it actually looks like, here I am out in the field in an aged care facility, and we simply turn the patient's bed or favourite chair into the dental chair, and then we swing on around with you know, digital technology and portable dental equipment, and then it's really just business as usual. So does that give everybody a bit of an insight as to the way we work? It's really nothing different. It's nothing new. We're just taking our everyday out into the field. Next slide, please.
Okay, that's the one of you waving to us, Mark.
That's right. So the previous slide was of the dental loan, which was a unit I used for a few years, and now I'm using the NSK Viva Race. And what I love about this technology is that it literally fits in the boot of my car. I do tend to work a lot, well, mostly solo. And on the left here, you can see, you know, how portable it is. And really, I like to be only set up so that I'm only making one trip from the car to the person's room or you know, wherever they're located in the group home. And on the right-hand side, you can see the basic setup with, you know, we take over a chair or a little table and we set it up. And then if you can sort of imagine a circle from the Viva race to the patient's head and neck area, and that's our corridor of care. So that's the dirty zone, and then everything outside of that is, you know, basically where we avoid. So we're going to confine our treatment to that little triangle. Next slide, please, Kathy.
Okay.
Okay, so we're here to talk about silver fluoride, and here's an OPG for the patient we'll be doing our case study on today, and I guess you know, you don't have to be a dentist or a therapist or a hygienist to see the amount of destruction that's going on, and this is actually someone who's in an aged care facility. However, you know, this chap was only 72 years of age. He had a malignant carcinoma, squamous cell carcinoma, left side of his tongue, which unfortunately had metastasized to his lung and other parts of his body. And because he'd been a smoker his entire adult life, and with his emphysema, it was decided that they couldn't put him under a general anaesthetic and do all of the surgery that he needed. So he's really just sort of hanging in there. And to meet him, you know, you could see that he wasn't looking too well, but really had a very positive outlook. And his chief concern really was certainly function. He wanted to be able to enjoy his meals, but also his dignity. It was extremely important that when his grandkids came to visit, when his family came to visit, that you know, he was able to smile and present himself in the way that he wanted to present himself. So this was as much about patient dignity, and certainly, amazingly, even looking at that OPG, he wasn't in any great discomfort. So he wanted to keep his teeth, he wanted to be able to chew, and he wanted to be able to smile. Next slide, please, Kathy. And so, you know, and what I said before is very real. And the Black Diamonds Rock handout that you've provided, Kathy, has been really quite wonderful in that we can show our patients before we get started exactly how black the CSDS technique will make the act of decay, and we're able to get true informed consent, not just from the patient, but when I've used it in patients with dementia, etc. Clearly you need to get consent from the family members and their legal guardians as well. And if people can see a picture and understand the process and how well it's organised, and the fact that there may be 1 or 2 or 3 more visits after the initial treatment visit, well then, you know, I feel that I feel comfortable, and the family and the patients feel comfortable knowing the process that's going to follow. So the ARMA approach, it has given that some structure, and everybody knows, everybody's on the same page. Okay, next slide, please, Kathy.
Done.
So what we're looking at here is how the situation presents itself. And if you can imagine the OPG, well, all of those areas of decay, well, then when we look in the mouth, that is literally, you know, that ring barking root caries, full of food, full of plaque. Remembering this chap not only had all of the health issues that he had, but also the medication left him with a very dry mouth, a true dry mouth. And some days he had more energy to dive in there and keep his teeth clean. Well, he thought he kept his mouth clean. Very proud fellow, didn't really want people brushing his teeth for him. Those gums were quite sensitive as well. But, you know, we were able to get some photographs and explain from the outset the fact that most of these teeth, well, that all of the teeth had a hopeless prognosis, but that we were going to do our very best to stabilise his situation in order to try and to improve his aesthetics and keep his teeth for as long as possible. But he was given very realistic expectations. The next slide, please, Kathy.
Okay.
So step number one is to, clean all that food and plaque away. And this is a photograph taken straight after we've done our scale and polish. You can still see there's a little bit of sort of saliva around there. And again, you don't have to be a dental professional like us to see that there's some serious problems there. And you're quite amazingly not in any great discomfort, but that ring barking has left the teeth extremely weak. They're almost sort of flexing. You can get your fingers on there and give them a flex. So, traditional conservative restorative process here is really not an option. So what are our options? And really, this is where the silver fluoride has really comes into its own when it comes to aged care. Can I have the next slide, please, Kathy?
Done.
So application of the silver fluoride itself, and you can see the little white areas where it's just tickled up the gums there a little bit. Interestingly, that process with the fluoride really does improve gum health, as well as going in there and starting to stabilise the active decay. So we leave that on there. We dry it up if we can. Leave it on there for a few minutes as per Kathy's instructions. The next slide, please.
Okay.
And then we apply our second level. And look, you can see I've possibly missed a few little spots there, but it does sort of seem to drift around and soak in everywhere. And I'm also quite mindful of not trying, we do our best so that it doesn't splash everywhere. And although this patient was reasonably compliant, he still did struggle a little bit with treatment, especially with, the fact that you can look at the tongue there and you can see that really dry tongue. So he's sort of trying to swallow and keep it all together while we apply our silver fluoride to all of the teeth, outside, inside, and we did do the whole mouth in his first session. So we're back, and he was quite accepting of the appearance. And we were back then, as per ARMA, to review that again. I think it was about 10 days after. Next slide, please, Kathy.
There we are.
And we can see, again, despite a lot of a very thorough oral hygiene instruction routine, and we tried to get this chap onto an electric brush, although, I wasn't that strong on it because I was concerned that the teeth would get rattled around too much. But certainly we were there with this fellow's sister and one staff member, and tried to get him to really improve his home care. And certainly it's a little bit better than it was, no doubt. But you can still see a lot of food and a lot of debris. And that's because the gaps left by the decay the teeth breaking down are just so huge that he did struggle to manage that. Not so obvious on that picture, but the gum health was a lot less red, a lot less inflamed. And we can see the shiny cryodentin on a few of the teeth, and in fact it worked quite well for most teeth, but we can also see in a couple of other areas that it needed to be reapplied. Can I just have the next slide, please, Kathy?
Yeah, it is.
And you can see in other parts of the mouth, really quite an excellent result. That's down the lower left-hand side. And then if we could have the next slide, please.
Done.
And, very not such a great result in other parts of the mouth. So it looks like and I can promise you, I did apply it to all teeth. But in this instance, it looks like it hasn't sort of really worked at all. So, we took the opportunity to use the ARMA approach and reapply. And if I may have the next slide, please.
There we go. And
this is a photo, the best photo I have of this chap's aesthetics. And you can see, yes, this is certainly on the day that I reapplied the CSDS for the second time. But I also took, I could see that things were working and he was comfortable. So I did take that opportunity to get some impressions taken. And you can see, where this patient's coming from. His chief concern was to hang on to his remaining teeth, but also to be able to smile so that when his family came to visit him And, you know, he's still a reasonably young man, and family, friends, grandkids, young grandchildren were coming to visit, and he didn't want to look like this. So extremely important that we hang on as best we can. And what this slide does also, this photograph also shows, is that, you know, I wanted him to be able to smile comfortably. So we do need to look at some sort of combined approach. So we're going to be combining the silver fluoride stabilizing technique with a little bit of minor restorative work. And when he's smiling, this isn't how he smiles, but it will give us some indication that we really need to just look at those front three, the three obvious front ones, to do some restorative work, along with getting a plate in, a little partial denture. Next slide, please, Kathy.
Okay.
Just going to quickly go to this one, if it's okay. These single, I am moving towards disposable instruments, and this is the particular kit. And I thought, because we are clinicians having a discussion, I just thought I'd share this one with you. And these single-use instruments I've found absolutely wonderful. And you know, they're small and lightweight. They're quite economic as far as the viability goes. You know, these kits, you can get an exam kit for under $3. The restorative kit, I think, is about $4.25 per unit. So, you know, you can have all of that there. And look, I am as concerned as anybody about filling the rubbish tips of the world with disposable this and that. But in this instance, and I think why I certainly included this slide today, is that I think whatever we can leave behind whatever's been in somebody's mouth, and whatever we can leave behind in their room, so you're not actually moving back to your surgery and I often see multiple patients, so I'm not going to be carting other people's dirty instruments around. And although that's done in a concealed hard plastic box, I am moving more towards disposable as much as everything, as much as I possibly can. So that's that single use, which is an excellent brand. Next slide, please, Kathy. So we finally stabilised those front ones. The slide on your left, that is food. That's not a composite. And I do, you know, if I knew I was going to be giving this presentation, I probably would have flushed that out so we can see it better. But I like to take the photos because we're constantly showing the family and the carers and the patient how much plaque and food particles are being left behind, despite their best efforts, or, you know, their efforts. So it is an important educational tool, the intraoral camera, as you're probably all aware. So the slide on the right-hand side, and look, you know, it's composite with some GIC. So I use, I've put in some flowable GIC to start off with, and then a little bit of flowable composite on top wherever I can, and we polish that up. And although it's certainly not going to win any awards for clinical dentistry, it is important to remember that, you know, although this chap was reasonably compliant and was doing everything he possibly physically could do to help, it's still not an easy area to work in. But there we have some aesthetic composite, or, you know, white restorative material at the front. And the next slide, please, Kathy. And then we have our final result. So we've put our little 3-tooth flipper in. We've got our composite on those front. You can see, if you look right up onto that, you know, the 1-4 area, you can still see some black there. But, you know, our patient was very, very happy. And the family, you know, his sister in particular, was over the moon. And then, of course, you know, when I do my TLC follow-up call, which I like to do a couple of days after, and then I do it a couple of weeks after that. Also, they were just extremely happy with the service and extremely happy with us being able to save the teeth and then get, you know, something in his aesthetic zone to, you know, for his dignity with with family visits. So that's pretty well it there, Kathy. Was there any questions, or can I explain something better or differently?
I'm just going to, it almost made me cry seeing that result, Mark. It was beautiful.
Well, like, you know, I must say, I was very happy, and you know, the patient did have a tear in his eye, and his sister was, you know, just overcome with the end result there for us. And as you can see, it really doesn't take much, you know, just to with a little bit of planning and the silver fluoride to work on those, you know, all of his posterior teeth, and then stabilise the caries at the front. We get the cryodent in there, and then we're just back with our portable equipment. And all of this was done in his room. You know, he didn't have to leave his comfort at all. And he is an extremely positive fellow, but he is frail. And you know, those visits, if you can, you know, if you can keep him comfortable, then everyone's a winner. So. Yeah, thank you for introducing me, or reintroducing me to the fluoride, Jackie. And this all started from your presentation down in Albury when we caught up there.
Oh, it was good. I was happy to have you along. Somebody has said a great work, such an inspiration in the chat. We've got a few minutes. If anyone wants to unmute themselves and ask a question, go for it.
Sorry. How far down the root surface would you go if it's some gingerly?
Yeah, that's a fairly easy one. I just use the little cotton buds, or even the little, you know, what you would apply your composite bonding agents with. So those little plastic sticks with the foam on the end, the micro brushes, and I literally pop it under the gum and go up until I can, you know, until it meets some resistance. So I'm not frightened at all to go subgingival with that. And just, I do note that it does seem to flow, you know, it does flow everywhere. And although you're not, you know, you're trying to stop it, you're trying to keep the bare minimum amount of, you're trying to keep it into the treatment zone, it does flow. So no, I get it, and I pop it right up under the gum and give it a little wiggle. And if the patient's compliant, wonderful. And then I just give it a little dry and let it sit for 3 minutes. So as far as I can go, I guess it's the short answer to that.
I just wanted to note on one of those slides after you had applied it, Mark, it looked like there was some white stuff on the gum, which a lot of people might think could have been a gingival burn, but it's not, yeah, because you were using CSDS with a pH of just 6. Now that is that markage is just where the silver is going into the tissues, so and going on to the tissues. So that's not it's not a gingival burn, just in case anyone was looking at that and going, I wonder what he's doing with those gums.
Yeah, and it's we see those white marks, you know, with in-house tooth whitening. You know, if we don't get our you know, the protective barriers in place, and we can, and certainly when we used to use TCA a fair amount, it was literally a chemical burn. But that's absolutely right. There's zero burn there, and the patients feel absolutely no discomfort whatsoever. And
thank you so much for coming along and sharing that, because it's a very, very impressive case. And if anyone needs any convincing that you can use it in extreme examples, then that's certainly one where most people,
you know, and that's right. It was certainly what I really wanted to show was the fact that silver fluoride is very helpful in combination with other sorts of treatment. So it can be used as a standalone if that's the only, you know, and I do use it for patients who are even more frail than this chap. We can use it as our only, you know, the start and the finish of treatment. Important to reapply every 3 to 4 months. So it's important that we get consent to come back and, you know, keep the show on the road. But it's also, you know, as I said, can be used in combination, can be used portably, so not just in your surgery, but out in the field as well. Yeah, very, very helpful tool.
That's great. All right. Well, I'm afraid we're going to get kicked completely off. So
Right. Okay.
what
Short
I'm
and
going to
sweet.
thank you so much for working with this very difficult situation where I'm in control of your slideshow. We haven't done that one before.
Yeah. No. Well.
So, maybe I should go and do that Zoom course that was offered for free by Zoom the other day.
We muddle
Anyway,
through. Kathy, it's always great working with you.
Yeah, this is going to be recorded and it's going to be popped on the Silver Fluoride Practitioners Q&A Exchange Facebook group. And so everyone will be able to see what you've been up to. And just a word on those disposable instruments. I've used them as well. They are fabulous instruments.
Yeah.
Yeah.
Yeah. I think it's the future, certainly when you're out of the surgery.
Yeah, yeah. All righty. Okay, well, thank you for coming along. Thank
Thanks,
you.
Jeff.
I'm just going to finish the recording.